Hello, how are you doing? Today we'll discuss about diagnosis of the pregnancies. What is the importance of early diagnosis of the pregnancy? What it is advantage and what method for diagnosis of the pregnancy we will see in detail. We'll see in detail. Okay. All right. Sorry. Early diagnosis of the pregnancy is very important. It is mandatory to provide better health care for the mother and her fetus. To start early ANC follow-ups. And also, early diagnosis of pregnancy is important to prevent exposure of the fetus from hazardous substance. For example, if she has substance abuse related with alcohol or coffee or other substance, she must be restrained from that one if she know her pregnancy status. And also she must be restrained from teratogenic drug or other X-rays if you know her pregnancies. And also early diagnosis of pregnancy is very important for management of ectopic and non-viable pregnancies before it is going to the complications. There are three evidence or manifestation used for diagnosis of the pregnancies. From this, the positive evidence is the absolute evidence for diagnosis of the pregnancy. The rest, for example, probable evidence is around 50%. Suspicion of the pregnancy, presumptive evidence is somewhat the subjective evidence that we get from the patient. Science symptom or presumptive evidence is almost less likely for diagnosis of pregnancies. It is not absolute evidence for diagnosis of the pregnancies. For example, the evidence related with presumptive evidence for diagnosis of pregnancy, for example, amenorrhea and fatigue. There are so many differential diagnoses related with amenorrhea, sensation of menses. Amenorrhea, you know that there are so many differential diagnoses related with amenorrhea. Don't go in detail. So among them, if one pregnant woman has regular menses previously, now a sudden sensation of the menses, you may be suspect the pregnancy. If there is fatigue, also another suspicion of the pregnancy. If there is morning sickness, breast changes, mastodynia, pain sensation on her breast, primary areola, Montgomery tubercles, colostrum of secretion, secondary areola. Those all things are maybe suspect the pregnancy. Quickening, if the mother feels the movement of her fetus in the uterus. If there is blood irritability, the frequency of urination, maybe you can suspect that one. So, but there are so many differential diagnoses related with what? Maybe, for example, if you infection. If she has DM, there is frequency of urination. But among them, pregnancy is one, the differential diagnosis related with that one. Increased body temperatures. For example, skin change. If you take skin change, chloasma or melasma is a face mask pigmentation during pregnancy. You can suspect that one. The pregnancies. Linea nigra, if dark line pigmentation. If the dark line pigmentation from symphysis pubis to the xiphoid process, palmar erythema or telangiectasias. This one is due to vasodilation of the capillaries, though the skin changes into red or purple. The hysteria gravidarum or stretch marks on the hair abdomen also you can suspect the pregnancies. The second evidence for diagnosis of pregnancy is probable evidence. Somewhat is better than the presumptive evidence. For example, Chadwick sign. A Chadwick sign is a bluish discoloration of the vagina or vulvas. And also if there is leukorrhea, white yellowish discharge from the vagina. Hager sign. If there is lower uterine segment, a softening of lower uterine segment, special isthmus, abdominal enlargement, and brachial contraction is the painful. Or if there is constriction on the abdomen, but it is slightly relieved with walking or somewhat exercise. Somewhat it is another manifestation of the pregnancy. HG test. HG test is positive in the blood and the blood and the urine after 10 days of fertilizations. After 10 days of fertilization. And also the another one evidence for diagnosis of pregnancy positive manifestation, as I pointed out in earlier section. Positive manifestation is the absolute evidence for diagnosis of the pregnancy. For example, are you hearing fetal heartbeat by Doppler or fetoscope? And also if the palpation of fetal parties. And also if there is visualization of the fetus by ultrasound, especially cardiac activity around 5 to 6 weeks, and movement of the limb and finger around 10 weeks. This is absolute diagnosis for the pregnancy. Let me show you one question related with the today's sessions. Let me show you one question related with today's sessions. With the result who saw her last normal menstrual period on 6/6/2016 Ethiopian calendar, and she had nausea and frequency of urination. She also had a tingling sensation of her nipples. Her menses was previously regular. Based on this scenario, which type of evidence is used for diagnosis of the pregnancy? A. Presumptive evidence. B. Probable evidence. C. Positive evidence. D. All of the above. Let me leave you the answer for you. It is enough for today. For next time, I come up with the other title, the other topics. Until that, goodbye. Don't forget to share, like, and subscribe these YouTube channels. Have a nice time. Thank you.